So the reason why I wanted to contribute to the racial equality session really is because, this topic is personally and professionally important to me. And I'm aware that the Q event will likely attract a broad audience of people who are interested in not only understanding the issues, but also thinking collectively about solutions.
The context of COVID is really what's driven me to want to be involved. So what we saw during that first wave was a sudden kind of a realization of the inequity that we always kind of knew was there, but it became so much more visible that it felt more wrong. And this is obviously in the context of Black Lives Matter and a kind of an understanding of how that can have such a negative effect on people. And it became very personal for me when I lost a colleague, one of the first few healthcare staff who passed away during COVID.
I think for me it was before the pandemic, volunteering as a Freedom to Speak Up guardian in the NHS, and I was really quite surprised and struck by how the majority of people coming to me speaking up were people of colour, predominantly women and people of colour, talking about how they were being negatively impacted in their professional development.
To affect change for me is something that requires a really multi-dimensional, multidisciplinary, multi-angled approach. So I wouldn't call myself an expert in EDI, and I don't want to be portrayed as that, but whenever I talk about it, I use the iceberg model as it's a very simplistic kind of improvement model, but it's a model that I think really enables us to see things from multiple angles, multiple dimensions, a recognition that to have true change, you have to really deal with the systemic issues that exist. But those systemic issues have existed for hundreds of years. 10 years ago, 20 years ago, 30 years ago, there would be people like me having these same conversations, answering these same questions. And so there is clearly a necessity to kind of make those structural changes going forward. And that can sometimes seem really daunting.
Sharing power doesn't diminish it, but actually increases it. Involved in this process, in this movement, a bit like we've seen with Black Lives Matter.
So we created a campaign on hexiton.com that allows people to either request support around their professional development that they might need to make the situation slightly more equitable, or from the white perspective, or in, I guess anyone's perspective, how we can offer our time to support people of colour in their professional development. We've seen some really fantastic opportunities coming on the platform as a result of that. And what I really like about it as a white guy in talking about this situation is it's a practical way for me and others, and now indeed anybody, to take practical action to support reducing inequalities for people of colour in the health system. And I'm really proud of that.
On a personal front, I'm involved within, I mentioned it before, the CSP BME network. The bit I'm particularly involved in at the moment is around creating a mentoring and coaching support system, a network. So that isn't quite ready to go yet, but that's the thing that we're working behind the scenes. So just something that is a positive offer to our members, our students, qualified members, that enables them to really access the wealth of information that there is already, and giving them the skill sets to navigate the career pathways.
A large part of my role is using data to look at our staff experience working in our organisation, and we clearly have a difference in the experience of staff from a Black and Asian background to our white colleagues. What needs to happen next? We need to always hear from those who have the lived experience and understand and act as authentic allies. We need to see more representation throughout our organisations and society positions. There have been some reverse mentoring sessions where our senior leaders have been mentored by members of staff in our organisation from varied backgrounds, and the learning has been huge for our leaders.
I think it's been really good that, you know, the impact of COVID on BAME populations, as well as the added conversations triggered by, you know, the race conversations from the George Floyd murder, you know, has brought a renewed energy and focus into the conversation. You know, initially there was a lot of venting and we all had to vent and talk about the issues, but now it's been encouraging to be part of, you know, the focus on identifying and embedding solutions. And it really feels like there's a cultural shift, and the conversation isn't just amongst Black and ethnic minority groups. It's everybody that's recognizing that actually there is an issue and that something needs to be done about it permanently. And this needs to continue. The commitment needs to continue. And more importantly, we all need to hold ourselves and our leaders to account on the commitments so that we can continue to challenge ourselves, challenge a system where there's no progress. You know, we need a cultural transformation